So today we're going to talk about the differences between exercise and movement and how you might be focusing on the wrong thing in order to get into shape and age in a healthy way. I'm Risa Morimoto, your host. I'm an integrative nutrition and health coach, and you're watching Modern Aging, where we chat about innovative and holistic ways to elevate our health and well-being as we age. If you haven't subscribed to the channel yet, I'd love for you to do so. All you got to do is click on that little red button below with that little bell next to it to be sure to be notified whenever a new episode is uploaded. You can also check out our brand spanking new website at thisismodernaging.com. My guest today is Dr. Ada Wells. She is a doctor of physical therapy. She is also a Pilates educator. So she has this great saying how, when we turn 40s and 50s, our minds are often very youthful and sharp, but our bodies are falling apart and we're like, what the freak's going on? So she's going to help us create a better body-mind alignment through exercise and movement. We just started to partner with her on her program called Be Well, Stay Well. It's an online series of live and on-demand exercise and movement classes, Pilates and Somatic movement and the like. You got to check it out. So she actually has a very special gift for all you viewers who stick to the end. So you got to check it out right now. Hey, Ada, how are you?
I'm great. Thank you.
Thanks so much for joining me today. This is a really important topic for a lot of people, I think, especially as, warmer weather is coming upon us. We're thinking about moving a little bit more. We're coming out of hibernation, and even though we should have been doing this all along, and I think a lot of us, especially with the pandemic, have either been doing a lot of exercising and movement or none at all. So before we kind of get into the nitty-gritty of it, I wanted you to kind of talk about a little bit about your background and how you came to PT and Pilates.
I became a physical therapist about 25 years ago, and there's an interesting story even beyond there of why that physicality and exercise became a real part of my life. But I'll keep that for another story for now. But essentially, I became a PT, and one of the areas that I really spent a lot of time studying was actually looking at golfers. Golf was something I had actually played a lot of when I was younger. My dad, which is part of my interesting story, taught me how to play. He wanted me to play, and I kind of hated it at the time, but I realized the importance of it. And so I initially was, working, became a physical therapist. I'm working with people, working with golfers, working with more sports injuries. And, there's one thing that I kind of noticed, and that is that you can teach exercises, but you can't necessarily, when you're looking at something that's a really complex movement like golf, or for that matter, I like to say life is a rotational sport. Everything we do is rotation. It's looking at things where we are actually making sure we're not fighting our own bodies to try to be efficient in doing that. And so I actually started in about 1999 is when I actually started studying Pilates and became certified. And maybe about a decade later is when I started actually becoming an educator with it. But the difference between, myself as a physical therapist teaching exercise versus myself as a physical therapist teaching movement is night and day. And I think that's the key thing to remember, that it's less about, the 3 sets of 10 and, all of this sort of stuff, which is important. It's understanding where all of these different things fit. But where I come into play is actually really teaching people how to get the foundation of what they need before you start to add speed, power, resistance to everything. Because otherwise, that's the thing that tends to break you down. And
right.
I like to think,
let me go back just a second. So what do you mean the difference between exercise and movement? Because I do feel like people are using them synonymously, right?
Yeah. Well, we do move. You do both of them, but I can teach you an exercise that's a sit-up, a crunch, a roll-up, whatever you want to call it, whatever thing you do. And I can say, okay, put your hands behind your head, and you're going to go ahead and just lift your head. Okay, let's do 1, 2, and you're sitting there counting reps, right? And so they've done the exercise, they're doing it okay, and you're almost worried more about the quantity. Yes, you're worried about quality a little bit, and you'll give some little cues, like, okay, not so much neck, all of that sort of thing. But when you're teaching from a movement standpoint, that's where it can get really interesting. And that's where you can get a huge amount of variety. So you will very rarely hear me cue in a way where I say, engage this, tighten that, tuck this. I don't use muscles in my cues at all. I never use muscles, because when you use muscles as your cues, it tends to make people, it makes people more rigid. And so once again, having this background of golf and mobility and fluidity, it's like, I don't want people walking around like box on legs. I want people to be, really fluid in how they're moving. And so that efficiency is kind of cueing people from the standpoint of alignment or from the bones. So I might say, while you're doing that, that same chest lift or setup or whatever you want to call it, you place your hands behind your head, feel your head heavy into your hands so that your neck is relaxed, but your head is in a hammock. And now you're going to just let your hands, you're going to let the hammock go ahead and start to allow the head to float up, feeling your sternum slide down towards your feet. So it's this completely different place that we're cueing it. And so a person can sit there when I ask them, like, what do you do for exercise? Oh, I do 500 sit-ups a day. And I'm like, you wouldn't be doing 500 sit-ups in my version. You probably do 5 of them and be like, whoa, that was a lot of work. Because the intention is there to actually get you to not necessarily use momentum, but to get it from the foundational places I want you to get it. So once again, it's all about understanding the intention behind it. So an exercise is an exercise. Movement is kind of the journey. It's kind of how you get there.
That's great. And I feel like, Pilates in particular, it's such an interesting, I guess it's just an interesting method in terms of using resistance of your own body often, right? Or am I totally lying about it? Every time, and
no,
and that sustained kind of hold or whatever you're doing is, it creates so much strength, and it's really empowering after doing it for a while.
Well, what's interesting is that, maybe a lot of people ask the difference between yoga and Pilates. And, one major difference is that, Pilates can be done with equipment or with apparatus or without. And, and with the start of COVID, suddenly, they couldn't come in and use all of our cool equipment that looks like, medieval torture machines, but the reformer, the trapeze table, the chair, the spine corrector, ladder barrel, these very large and intimidating pieces of equipment that actually can serve as a way to either assist the movement or resist movement, depending, once again, on the user's, the teacher's intention. And so the thing is that a lot of people, they love being on the equipment because you can feel the potential of where you can move, and it's very liberating to be there. Sometimes the first place people come into Pilates is, they go to a mat class, at a gym, and it's, they're there with a bunch of other people. And the thing is mat Pilates is harder. It's harder when it's just really? You against gravity. Oh yeah. When it's you against gravity, there's nothing to help support you. So what we do, and kind of what I've ended up doing on my online site a lot, is essentially, because people miss their equipment and they think they need it, I'm like, you don't need your equipment. And this is where my PT brain comes in, right? I'm used to designing home exercise programs all the time. I'm used to saying, what do you have at home, and how can we turn that into an exercise device? Awesome. And so basically, I kind of created here's a little kit of what you need, a couple bands, and these are going to serve as my way to sort of replicate what we do in the studio. So once again, I understand the intention of when I give somebody an exercise in the studio of like, all right, you're doing this cool thing. Yeah, it feels great. How do I actually create that same sensation and that same intention of where I was going with that at home? And that's what we do with a small prop. So it gives you a little in between. And I'll tell you, a lot of my clients who are just gung-ho, like, oh, I hate mat Pilates, they love what we're doing, and they've gotten so strong because A, they've been consistent because there's nothing else to do, when you're stuck inside with COVID, and B, it's just, they've just been consistent. And no matter what you do, you've got to be consistent with it. But that working against gravity has also increased the resistance. So, as we get older, you do have to work out smarter. We understand that. I don't think you have to tell anybody, you got to watch yourself a little bit. Things aren't quite what they used to be. But you have to also work out harder. you can't sit there with the pink dumbbells all the time. Granted, I can make grown men cry with the pink dumbbells. It's all about how you use those pink dumbbells. But you do have to increase the amount of resistance. Now that can be in the form of what you're lifting, or that can be in the form of body weight. So a lot of times we do that. But once again, I'm about making sure your foundation is right. So if I'm strengthening you in a faulty movement pattern that you developed maybe after you tweaked a knee, tweaked a hip, tweaked a back, whatever, several years ago, when I was in college, when I was whatever, you fast forward and that little tweak to whatever it was, your brain kind of learned how to move after that injury, and it may or may not have been able to go back to what its original kind of more efficient pattern was. I mean, if you watch a little kid squat and you watch, most adults squat, those are two different things that are happening. And part of it is that we just don't do that anymore. Or you've had something happen and that's changed how you do it. So I like to think about what I'm doing, whether it's with the equipment, or with our props, or with gravity, or with our cues, is I'm training the brain. It just happens to be attached to your body. So everything we're doing, it's like the feet. Oh, there's so many things you can do with the feet. I mean, but what do? We wear like these, it's like wearing concrete blocks on our feet all day. If you're wearing shoes and you don't have this chance to explore, it's making sure that I die young as late as possible, basically, and it's having that youthful like exploration of what is possible in your own body is great. I mean, you can think about a baby just like, looking around and doing everything. It's developmental. It's just developmental stuff. And the problem is it is move it or lose it. Use it or lose it, move it or lose it. So It's kind of like reawakening those elements in your body.
So how effective do you feel like it can be? I mean, and what's the minimum do you think people really need to be exercising? And if they're going to do any form of exercise, is it Pilates that you recommend, or can it be any form of exercise?
It depends on what their goal is. So I always like to say with anything, I don't care if it's with life, if it's with exercise program, if it's business, where do you want to be? Where do you want to see yourself? And then we reverse engineer from there. I have some of my patients and my clients who they're like, they're in their 70 or in their 70s, super fit. You can tell they go to the gym and they're like, I just want to maintain my strength and, kind of have this youthful look as long as I possibly can. I'm like, okay, you're going to there's a difference in what I'm going to be giving you, because I still got to give on my end. I'm still going to make sure this person gets the foundation of the nuances of control, making sure those joints are where they should be, because he also comes to me saying, I'm bone on bone with this, that, and whatever. I've got my MRI shows herniated discs. And I'm like, you know what? You could probably do an MRI on most of the population. Actually, they have done studies with this, and it's like 90% of us, like over the age of, 45 or so. It's like neurosurgeons think they should be doing surgery on us based on the MRI alone. That does not tell the picture. It does not tell the clinical picture. It's looking at something where you're not moving. So when we're looking at what are we recommending, it just depends. If your intention is to be a golfer, you need fluidity, you need efficiency. You are moving at end range in like 1.5 seconds from one direction to the other direction. That's a whole different set of things that you've got to work on, versus somebody else who maybe they want to really, like I said, they want to get strong, and maybe somebody wants both. But the answer is it depends. But it's important that you have the element of control, and there's kind of 3 things I think are really important as we're getting older, as we're looking at exercise. One is you've got to have the control. That's the brain part of it. But that is super influenced by your emotions, about, like if you're stressed, if you're in pain, you actually move differently. Your brain doesn't know the difference between it being stressed out or being in pain. So sometimes when people say, oh yeah, I get this weird pain in my back when I get stressed out, it's like brain is going, oh, I've been there before. And it's just giving you kind of what you've inputted it in the past. It's an experience.
Right.
You need control, so that's brain work, okay? you need to have strength, all right? We do need to move, but in order to have that strength, we're looking at a couple of systems. We're looking at, as I like to say, you've got to have the beer, you got to have the beer can before you have the Dos Equis and the six-pack in that order. Okay, so I'll explain what that means. The beer can is essentially your core. It's if we look at the beer can, it's like your deep abdominal muscles, and it wraps around to these little stabilizing muscles of the spine. The top and bottom are the diaphragm, that's your breathing muscle, which can actually act when it's doing the right thing, it's acting as a respiratory muscle, but sometimes it has to act as a stabilizer. So when people say, why am I winded? It's like, well, you're probably stabilizing with your breath, and that's giving us some clues. And your pelvic floor, and boy, we all need a good pelvic floor there. So that's your deep core. And so that's got to be functioning well to support the Dos Equis, the two X's. So once again, we're in Mexico, so of course I love these little analogies. The two X's are more of these, what I like to call mover muscles. Those are the big muscles that are doing the big grand movements. So we have this relationship of muscles sort of under our armpits that cross our obliques, cross our bodies like an X, both in the front and the back of us. So people sometimes don't realize that when you get something going on in your shoulder, maybe your right shoulder's got issues, I'm overlooking at the opposite hip, because sometimes people have weakness on one side and they don't realize that they're doing something functionally that's actually now binding you because you're using that as a compensation. Once again, these are the nuances of things that, people like myself are looking at. So you got the Dos Equis. Those guys are your movers. So yes, those are going to respond well to these strengthening. You're going to the gym, you're doing the things, you're doing the big movements. Maybe not so much of the little dead bugs and the really more the small fine tuning stuff. And then lastly, the six-pack. I mean, the six-pack looks great, but that's almost kind of the least important out of the three. So once again, it's like making sure you have those elements of strength. So we said we need brain, we need with the control, we need the strength. Then there's range of motion. But it's not necessarily, it's not just a flexible thing. People a lot of times, they don't realize they have tightness in their neck and they're like, or my hamstrings are tight. That's what you hear a lot. Oh, my hamstrings are tight. Can you show me a stretch for that? And I look at them and they bring their leg up around their head. I'm like, you don't need to stretch your hamstrings. Your hamstrings are not tight, as in shortened. Your hamstrings are taut. They're working too hard. And this can be true for the neck muscles, upper traps. Oh, when these are tight or taut, do we need to stretch them, or do we need to activate something else that needs to be doing it? And so for a lot of us, if you got a little forward head, you're probably overusing these back neck muscles and your upper traps and what I call your abs of your neck, your deep neck flexors. So when people see in a lot of Pilates classes are doing something called the 100, where their head is elevated and lifted, you're using your deep neck flexors. Guess what? That's a postural muscle. So even though that exercise is in a rounded position, in a flexed position, you get out of that and you feel actually more upright because it just let go of all of this, and this guy did its job. And so those are the things. And here's the thing is that with that range of motion, why I'm not a big proponent of like, here, do the stretch and that's it, is because we didn't address these other two systems. If I give you a stretch, or I give you a massage, or I do something to manipulate it, oh, it's great, all right, that's wonderful. But then your brain strategically is going to say, okay, now I don't know what to do with this new motion. I only know what I know. And it's going to go back into that same pattern. So that's where when something feels great and then 24 hours later, you're kind of like, oh, darn, I feel it again. That's telling you it's a strategy. That's telling you it's the brain. That's what I do. Right? So depending on where a person is, persons might have the strategies and the range of motion is good. They need more of the strength. So we have to look at where they sit on that spectrum. There's some people that are loosey-goosey and they have all sorts of range of motion and they think they need stretches. That's why you go into yoga classes and I'm like, y'all are already flexible. You need some stability. You need to know where you are in space. They don't know where they are in space. They're like, oh, I'm right over here, some weird position. Well, do you know where your arm is? Do we know where your shoulder is? Your shoulder joint is in some weird position that is not going to do you favors and is going to wear things out. So it's about keeping the joints congruent. That's a word I use a lot. So a congruent joint is in exactly the most ideal position to where you're not getting the wear and tear. So even though someone might have arthritis or have arthritic changes and all those things I talked about, scary things on your MRIs and x-rays, I kind of don't care. I do, but I don't. And I don't care because I'm like, all right, so we look at why you have all of that wear and tear. It's because you were probably missing one of these things. So what if we reinstate, kind of like, let's get that control, let's get the brain understanding where you need to be in space. Now this joint can be in the right alignment so it's more congruent. And oh, guess what? Because it's no longer getting all the shear, it's feeling better. So that's me as the healthcare professional, as the physical therapist, infusing my sort of background knowledge into what we're doing from a movement standpoint, and blending that. So
you were doing this live pre-COVID, right? With your clients.
Yeah. You know what? Yeah, I would do it in person. Yeah, so we were in person. This is what I do. I could, they come to me, and they might come in classes where it'd be more general, just not too much different than what I'm doing online right now with Be Well, Stay Well. But, and there's certain little rules. It's like, if 50% of women over the age of 50 have low bone density. You might not know that. That's an important thing because there are certain movements that are contraindicated that you should not do. That can actually make it worse. And actually Pilates is an exercise. Share a couple of those? Yeah. So for example, if you are over the age of 50, you have low bone density, so that's osteopenia or osteoporosis. Where that's affecting is actually the spine. And primarily it's the spine, the hips, but the spine is where it manifests itself. And the thing is that if you are doing exercises where you are bending your spine forward, the way the shape of that spine is, of the spinal vertebrae, when you're putting a force on something, you can imagine if I'm pushing on my fingers here and I'm putting a force there, this is like spongy bone. That part of the bone, it's called spongy bone. So if somebody has a less dense sponge because they have lower bone density, and you go and you put loaded flexion into it, that can lead to compression fractures. So when you see the little old lady that's like this, that's probably some compression fractures. You may or may not feel it. You might have had some back pain and it went away and you didn't know, you didn't do anything. So it's called the silent disease. People don't realize it. So the thing is that if you look at a typical Pilates class is probably 90% flexion. So that's what's a little different about, when we're looking at sort of what people might see in Pilates going, whether it could be regionally. There's classical Pilates and contemporary Pilates, and contemporary kind of brings in a lot of different things, which I'm more contemporary. But the idea that you can modify an exercise, it doesn't mean that it makes it easier. I like to tell them, I'm like, my low bone density people work harder. But that's okay because you got to work harder as you get older anyway. So woohoo! But it's understanding that that we're not going to be going into spine flexion, but you can still work the heck out of your abs or at whatever it is. So a lot of the classes that I teach, I put in there. I'm like, this is safe for those with low bone density. Especially if they're a foundation class. So people understand, like, oh, okay, if I have this, I shouldn't move into this particular motion. So I always will give a version of like, all right, I have everybody do the low bone density version so they can all appreciate it's not necessarily easier. And then I give one for those who can move into like flexion or flexion rotation, which is no-nos for people that have low bone density.
So tell me a little bit about your online classes. I know that you had to kind of switch over because of COVID, but with that, I mean, you have a whole program and you have other classes aside from Pilates now because you were kind of forced to.
Yeah,
but now you can reach people all over the world, which is amazing.
It's really fantastic. Pre-COVID, I've been, plunking around in the online space for quite some time, probably for about 5 or 6 years before COVID. And the biggest thing was people were like, no, I don't think I would get much out of it doing it online. And I can't really disagree with them. It's hard sometimes to work out to a video because you're missing out on this interaction. You kind of, you're sitting there, you're at home and you're working out, and then you kind of look over and you see that sock that you should probably go pick up, and you go do that. Next thing you know, you're not even working out anymore. The way my actual platform, and so this was before when I had my platform, my old version. It was pre-recorded classes, right? And you go in, you do it, and that was it. But with COVID, there's a couple things. One is that people needed and want the human interaction, right? And I wanted it because I don't want people just doing something unless they really know what they're doing. And so we were, I created this platform, and inside it's essentially, once you log into the class live, it's a Zoom class. And so that way we'd always, in every class where I always saying hi to people, someone's new in the class, hey, good to meet you, that sort of thing. Not too much different than in a regular setting. And then we'll teach the class. We have some different options. We have some classes that are kind of watching the teacher demonstrate as she teaches. He or she teaches. We have both male and female. We have some that are called Eyes on You, where the teacher will teach to the screen and actually make corrections to people as they're doing it. Once again, very much like you might see in a regular environment like that. And then we have interactive Q&As where we'll have physical therapists, or people that have different specialties, and they can come in and we really talk about how movement and giving our perspective so people can ask questions like, hey, I've got this bad shoulder, or should I be doing this or that? And this gives us the opportunity to still have this group interaction in a safe space. But what's nice is that after every class, regardless of the format that we used, there's always the opportunity to talk about, so what did you guys feel? And what's interesting is that when I look at how many people start the class versus how many people end right when it's done versus how many people stick around for maybe the 10 or 15 minutes afterwards, first of all, if somebody has to leave early, they always put in the chat, sorry, I had to leave early because of da-da-da-da-da. People, it's the accountability, right? You're not going to leave early. You're not just going to walk out of a class if you go to the gym or go to a studio because you're going to feel weird about it. You're there, you're going to do it. So that's what I'm finding that people really enjoy, is that accountability. And not only that, it's the sharing and connection afterwards, because then they're sitting there and they're realizing, someone says, wow, when I did this, I felt this or that. And someone else, and I'll like, hey, what did you feel? And like, oh my gosh, I felt the same thing or not. And so it's really this fun way of people sort of seeing that, oh, I'm not the only one that feels this or has this issue. And you feel like you're in this place that you belong. It's your tribe. I hate using that word, it's overused, but these are your peeps, and so it's just everybody's on this little journey of wellness together, and then that's what makes it fun. So that's kind of how it evolved.
Predominantly women. You focus on women predominantly over 40 or 50 years old too. It's not. I'm sure you may have people who are 20, but it's really
you know what I like to say, and not even necessarily women, though women are drawn to it because Pilates, once again, it's like Pilates and yoga tends to attract women. My golfers are mostly guys, and they're in there. So the thing is that it's really for bodies that have been places. You can be in your 20s or 30s and have a body that's been somewhere that needs a little extra, like I need a little extra tune-up fixer or something here. So that it's actually right for me and I can move on safely. Not all workouts are appropriate for everybody, but there's something in there for everybody. And we have over 100 live classes per month that are in there. And we also have right now uploaded, and it's just merely because I haven't uploaded, I've got a bunch of them sitting on my hard drive, at least 150 classes that are in our on-demand section. That some of them are function classes where they're all upright for people who don't like getting down on the floor. Maybe they're working on balance, maybe it's working on more strength elements. We've got foundational classes that are really for the newer beginner people who need to kind of take it slow. Maybe you haven't done Pilates before and you want to kind of know that you're doing the right thing. And once again, not necessarily hearing those tuck, squeeze, grab terms and starting to learn how to move more with some efficiency. We've got flow classes, which are kind of a little faster moving. You've done this a while. You don't necessarily need to have every single cue. We can focus a little bit more on really that dynamic movement, but we're keeping all those principles in place. And then we've got ones that feature certain pieces of apparatus that are that a lot of our members have. So like I said, a lot of our members have like the little props, foam rollers, bands, little inflatable balls and stuff. And if you don't, they're pretty inexpensive to get. We have this other really interesting thing called the OOV. It allows us to work the body three-dimensionally. And as a physical therapist, things that used to take me 5 to 6 visits to do with somebody, I can do in 15 minutes. I'm like, it's a lot. I said, it's not the cheapest prop in the world. It's like $179. I said, but it's a whole lot cheaper than going to the physical therapist multiple times or whatever. It's like, and it's this great little thing. So yeah, so we have like, we got things for everybody. There's a lot of things, and there's some yoga in there. There's even a couple meditation classes in there, and so and then we have guest contributors that come in that are from all over the world. So there's kind of a lot of fun stuff in here. I have fun taking all these classes with these other guest teachers, so I don't get anything done.
That's so amazing. So actually, anybody who's viewing this video can actually give it a try. Is that right?
Yeah, I'm going to do something really special. I have not done this for anybody else, so I'm doing this for your audience. We're going to have a special link that you'll link to, and it will give you a 7-day trial to go in there. The cool thing is you can go into the live classes right off the bat. There's a schedule. You just look at the schedule and then you see what looks good. The schedule is in whatever time zone you're in, so it makes it easy. And then, or you can just go and plunk around and peek at some of the on-demand classes because, like I said, a lot of what you see in there is representative of some of the classes that are taught live. So yeah, you can try it out, and if you have any questions, you can either comment on that particular video, and I'll see it and I'll answer it, or you can reach out directly. There's a link there.
That's so awesome. So as we wrap this up, and people have got to at least give it the 7-day trial. I took a couple of classes, and it's just so amazing. Like, cause I've been doing a lot of stuff remotely at home, and it was nice to really have that interaction and kind of doing it together and stuff. So, but as we wrap this up, are there any kind of things that you want people to kind of take away, to really have in mind as they're getting older and how they're like looking at their bodies or how they're feeling inside, of what kind of signals they should really kind of pay attention to and not ignore in terms of exercise and movement?
Yeah, we all need, yes, we know we need exercise and we need to move. Do we know how to move to be able to exercise efficiently? Are we strengthening? Are we saying, I need to strengthen, I need to go to the gym? And once again, people don't realize that the most busy time for a physical therapist is between about like February to April, because we're getting all the New Year's resolution people that hurt themselves. So it's if you're going to strengthen something, you need to have the foundation and the control. You need to have those 3 things. You need to have the neurological, like how do you control something? Do you have the range of motion, available? Because if you strengthen a limited motion, that's not going to do you any good either. And do you have the strength? Because once again, as we get older, that becomes really, really, really critical to keep you moving and keep you young and really viable. So it's listen to your body. Don't try to bulldoze through something. I think one, kind of an analogy that I'll kind of leave you with is something I use this analogy with my golfers because they get it, because the whole drive, I want to drive, it's kind of faster, harder when they're sitting there trying to hit this golf ball. And I'm like, okay, drive. Let's think about like a really fancy sports car. Let's pretend you're like this Lamborghini or whatever, right? So you are, when you're a teenager, you're in your 20s, you're the Lamborghini, you're sexy, you're powerful, you're shiny, you're good. Everybody wants to, be a part of you. And let's pretend this Lamborghini has to commute every day. Like, I'm in the San Francisco Bay Area, so we have some freeways that are a little bit questionable in terms of potholes and everything else. So yeah, you can power through the potholes and get to work every day, back and forth, 40 minutes or whatever, you're doing it. But if you don't, if you continue doing that, over the course of a few years, 20, 30, 40, whatever years, what's going to start happening to the Lamborghini? Okay, if we're not really taking care of it, it's going to start, things are going to start rattling. It's, things are going to start falling off, making weird noises, maybe leaking power, leaking other things. And the thing is that I can go and do all my manual manipulation and fix everything. But the problem is, if you take that Lamborghini back on that road again, everything's going to fall apart. So let's look at the road. Let's look at the path. And that path is the brain. The path is the motor patterns. And so what if we slow down and we find the pothole? Like you're like, oh, there it is. Wait, let's stop a second. Let's go. Let's fill it in. And that's your brain having to figure out what it's got to do in space. That's and then it's like, all right, now let's go to the next one. All right, that's great. So we start smoothing the path. Now your Lamborghini can go. So it's got a bit more of a chance to be able to go further. So the longer you've been doing it and running over the potholes, it takes some time. It takes longer to sort of, fix them all. But at the same time, the brain is plastic. The brain will continue, we can continue to make changes to it no matter what the age, but the differences are the longer you've been going along with it. Like I said, practice doesn't make perfect, it makes permanent. So I just want to help people make permanent something that is more perfect. And that does involve, slowing it down and taking a look at what's really happening.